The COVID-19 pandemic continues to wreak havoc on our community. Currently, there are over 6,000 confirmed cases of COVID-19 in South Carolina that have resulted in 244 deaths in our state. Over the next hour, medical experts will update us on the medical and mental health aspects of this pandemic, as well as testing. Here is 5th District United States Congressman Ralph Norman.
Good morning. I want to thank all of our listeners for taking the time to join in. This is the 5th of a series that we are doing. The first 4 had to do with the funding through the CARES Act for this pandemic. This particular program today will deal with the personal mental aspects, and we have got a great group lined up to talk. Our first guest for 20 minutes will be Dr. Connie Guille. She is a psychiatrist, an expert on stress and depression. She is also an associate professor at the Medical University of South Carolina. Our second guest, who will have approximately 20 minutes to speak on the subject, is Michelle Leach. He is the director of the South Carolina Department of Social Services. Michael has extensive experience in child and adolescent needs, child welfare, and crisis response services. And our final panel will include Anita Case and Dr. Craig Charles. Both are from Affinity Health Center here in Rock Hill. Anita is the center's executive director, and Dr. Charles is the medical director for Affinity. I want to thank our broadcast host today, WRHI here in Rock Hill, who produced today's program, WZZQ in Gaffney, WBCU in Union, WDXY in Sumter, and Comporium Cable, which is in York and Lancaster counties. You can follow me on Facebook, Twitter, and Instagram at Rep. Ralph Norman, and visit my website and sign up for the email updates on norman.house.gov. We will have a replay of this entire hour posted later this afternoon on my website at norman.house.gov and my Facebook page, facebook.com/Rep. Ralph Norman. Dr. Gill, welcome.
Oh, thanks so much for having me.
Well, appreciate the time today, and for the next 18 minutes, we want to zip through some questions. We're leading isolated lives now as a result of COVID-19. Can you talk a little about the effects this pandemic has had on our mental health?
Sure. So we know this pandemic has actually had a very significant impact on mental health. Nationally, calls to our federal mental health crisis lines, our hotlines, are up about 900% greater than where we were the same exact time last year. And that's not so surprising, given that we know that stress plays a really important role in mood and anxiety and substance use problems. And in particular, those with pre-existing mental health problems, stressful life events can be very destabilizing. And I'd say to add to this problem, prior to this pandemic, we already had a very high prevalence of mental health problems in this country. About 1 in 5 Americans have a problem, and more than 50% of them don't get treatment. So this pandemic has really added some insult to some pre-existing mental health crises in our country.
You know, you bring up an interesting topic of depression, and, during the everyday course of living, all of us go through periods where we're down and just really don't know which way to turn. How do we know when depression or anxiety reaches the point where we need to get concerned about it?
Yeah, that's a great question. Yeah, because our mood and our anxiety does fluctuate, and it's a very normal and adaptive way to respond to our environment. But we know that there's a problem when those mood states, that anxious state, that depressed state, it persists, and it's there for most of the day, nearly every day, for at least a week or two. And most importantly, that mood state is really maladaptive. It's really impairing our ability to function in important ways, whether it's to take care of our own health, to take care of our relationships, to work, to be able to take care of our children, our families. So it's really looking at kind of the persistence of that and the duration and how it's impacting us. And that's really when we know it's a problem and we should get some help.
And what would you suggest? What are the warning signs that we all need to look for, clues that someone may be having trouble that's out of the normal? Can you talk about that just a minute?
Sure. So, there's a lot of information that we can get just looking at someone is behaving and how they appear. And anytime you're seeing any major changes in how somebody looks, whether they seem more sad or withdrawn or agitated or angry, or they're not attending to their hygiene like they normally do, or they're behaving differently, so they're not getting out of bed, they might be withdrawn or isolated, they might be using more drugs and alcohol to cope. So these are just some of the things that might suggest that someone's struggling, but checking in with them would really help you figure out what's happening.
Yeah, I don't think you can go anywhere during this pandemic and not see the look on people's faces. I was talking to a policeman a couple of days ago, and he was saying the despair that you can just tell that's there. From a mental health standpoint, is there any evidence to suggest that the pandemic may affect men and women differently?
Sure. So there's some really important sex and gender differences in mental health and substance use disorders. So women are twice as likely to experience mood and anxiety disorders compared to men, and men are much more likely to have substance use problems, although women are catching up a bit in that area. Where there's some really important differences is how people seek and receive treatment. So women are likely to reach out for treatment more so than men, and they both have barriers to care, but some of those barriers to care are a little bit more unique for women. Both men and women experience, stigma, difficulties with insurance, time off from work, transportation issues, trying to seek treatment and get services. But some of these, because of some of our gender roles, are a little more heightened for women. So, women are, many are mothers, and there's a lot of stigma with being a mom and having a mental health problem, or because, women typically spend a lot of their time doing uncompensated things such as childcare and elder care. They might be less financially independent in comparison to men, and therefore have more problems with health insurance or transportation, or just having means to afford childcare so they can attend treatment. So where this becomes really important in the big picture is if we think about women's roles in our culture and our society, is they're often the glue of families. They're the ones that are taking care of people's needs, making sure everyone's doing okay, and when they're not doing well, really families and communities fall apart. And so what we need to do is we need to make treatment more accessible or acceptable, I guess, to men, so that they're getting more treatment, and we need to make it more accessible for women to be able to seek services.
Yeah, and with the mother is most likely with that child day in and day out, and just relieving that mother of a couple hours of watching their children for them, I know can go a long way. The mother has a lot of responsibilities now more than ever. Let me ask you this: if any of our listeners now feel like they need to speak with a professional about a mental health concern, or if one of their family members or coworkers they feel is needing some help, where should they start? What resources are those that would be available that they can call and get help?
Yeah, and so I'd really think about kind of two groups here. So there's the folks that, over the next week or so, it makes sense for them to be talking to someone and getting into some treatment. And there's those that would really benefit for some getting treatment started right then, where they're really in crisis and need some immediate treatment. And for those that are in crisis, we are so fortunate to have in our state, through the South Carolina Department of Mental Health, a community crisis response and intervention team. So this service is for any adult or child in our state that is experiencing a mental health crisis. And they can reach out to them by phone. They're available 24 hours a day, 7 days a week. And what it does is it will link you by phone to a mental health professional that can do a clinical assessment, and then link that person to the appropriate level of care and make sure they're following up with them to make sure they have access to treatment and they're getting treatment started. Other resources such as National Suicide Prevention Lifeline is fantastic, and the National Domestic Violence Hotline. Both of those are available. I would say that in terms of someone needing to be seen in a week or two, wanting to reach out for treatment, if there's one silver lining in this pandemic, it's that we are finally able to deliver mental health treatments to patients' homes via video visits. And that has really been a game changer in making these treatments accessible and available to patients. So I can speak to services at the Medical University of South Carolina, the Institute of Psychiatry. All of our services right now are done via home video visits to patients' homes. So if they could contact our department and get set up for services. If you're wanting something more local, Substance Abuse and Mental Health Treatment Service Locator is a national resource that you can type in your county and look at what's available in your area and calling those places to make sure they're open and that they accept your insurance.
Yeah, and let me tell the listeners, we'll put all of these resources on our website at norman.house.gov with numbers so that you can make it easier to call. Doctor, what about anonymity? A lot of people don't, particularly if they have a loved one or somebody that they wanted to request help that maybe would not call on their own. Expand on that just a little bit.
Yeah, so if you're concerned about somebody and reach out to them directly and assess kind of how they're doing, how you can get them some help. And you can encourage them to call if you're concerned about suicide, encouraging them to call these hotlines. But loved ones can also reach out to crisis response teams to get them to come and assess somebody if they think that is needed. The other thing that they can do is they can just encourage that person to get an appointment with a mental health provider. They could make that appointment for them. They could make it easy and accessible for them to get to that appointment.
And it will remain anonymous who's making the request, right?
Yeah, of course.
Great. Now let's go a little bit deeper. Suicides are at an all-time high now, particularly among our veterans and among those that are distressed about what the business is suffering. What warning signs should we be aware of with those who are suicidal?
Sure. So in terms of warning signs, anybody where you're really seeing a major shift in their behavior, maybe they have a pre-existing mental health condition and maybe you can tell that they are not doing so well. Certainly drugs and alcohol, when that gets put in the mix, those people are at much greater risk for self-harm as well. But also just access to means. So really important that we are making our homes safe and securing any firearms or getting firearms out of the home if you have somebody who you're concerned about harming themselves, making sure you're getting rid of any stockpile of medications or getting rid of some alcohol or other drugs in the home, just making a safe environment for people and staying with that person, monitoring them, make sure that you're with them. And again, reaching out to community crisis response and intervention team if you're really concerned imminently.
Yeah, and a lot of times it starts with asking the simple question, how are you doing? And you can normally tell with people's faces how they respond, what they say. If it's something that is a lot deeper than what's shown, then you can take action. On our mental health providers around the state, how are they taking patients now?
Absolutely, yes. And as I mentioned, a lot of them are able to do that via home video visits. So it just makes these treatments much more accessible.
And what would somebody in a home who would like to have a visual interview, what would they have to make that happen? A computer, a phone? What would they need?
Yeah. So they need to have an internet connection for the video piece of that, and they also need to have an ability to have a camera either on a desktop or a laptop. They could do this on a smartphone. So sometimes when folks don't have that hardware, we borrow it from somebody else. Wi-Fi is pretty easy to hook up to in public places, and obviously trying to keep social distancing. But oftentimes you can at least find somebody who you could actually borrow a device or get an internet connection.
Okay. Touch on diet and exercise and the correlation between our mental health and a good diet and exercise. What do we need to be aware of?
Sure. So exercise is really, really helpful just for reducing stress overall and then therefore decreasing people's risks for mental health problems. But we've also seen exercise being helpful in preventing depression or a recurrence of depression. We've also seen it to be helpful to reduce stress and craving for substances. So I can't say enough about exercise and how helpful that is. And same with diet. So diets that are with the least amount of processed foods, the more whole foods, the more water people can be drinking, the better people's mental health and physical health.
All right, specifically children. A lot of times the child has issues, particularly with something like the pandemic. What can a parent do to protect the children from a mental health issue, or what steps would you suggest that they follow?
Yeah, so the whole balance is thinking about kind of age-appropriate, honest information while allaying children's concerns and worries. I think what I would start with as a parent and an adult is checking in with where you are emotionally with this, because children mirror our emotions. So you really want to make sure that you kind of have your emotions in check when you're talking with them. And just checking in to see what are their thoughts about this, how are they feeling, what are they thinking about, so you can allay any of those anxieties. And then you can also model for them really adaptive coping mechanisms. So, what can you do to feel better right now? And often kids, it's doing something outside or doing an art project or craft, or maybe just sitting and cuddling with their parent for a little while. But really just checking in with yourself, knowing your kids are going to mirror your emotions, model as much as possible adaptive coping, and just keep checking in with them and see where they are.
Well, you touched on this at the top of when you first opened the program about drug and alcohol abuse that's pretty rampant now. I think the data that comes out will show this. There's a jump in the substance abuse. What's some of the effective ways that we can protect ourselves and really those from going down that path of alcohol and drug abuse?
Yeah, so, if that's not something you normally do, don't start now, obviously. And if you've noticed that you are starting to have an uptick in your alcohol use or drug use, there are services available. And in fact, there is a service at MUSC where patients can access their service without any sort of an appointment, Monday through Friday, 9 a.m. to 11:30 a.m. And again, we'll give you those phone numbers and contacts where you can just call and get seeing someone evaluated and get treatment started. So if you're noticing that you're having an uptick in use or that use is starting to impact your functioning or your family, then I would reach out for services.
Well, that's good. And once again, we will post the numbers and all of the data on our website, repralphnorman.com. Dr. Gill, as a wrap-up, and from your past experience, what are 1 to 2 things that our listeners should know that you would want them to be aware of before we end?
Yeah, so I would just be aware of the fact that really nobody is immune to mental health or substance use problems. And in fact, right now, we're all more susceptible to them given the stressors and the trauma that's occurred as a result of this pandemic. And I think we need to appreciate that we already had a mental health and substance use crisis in our country, and that this pandemic has worsened this. And so as we think about this aftermath from this pandemic and as we rebuild our communities, we really need to be working on creating sustainable infrastructure that makes mental health treatment and substance use treatment available and accessible to everyone. And one way to do this, and as we've seen in this pandemic, is using telehealth. And so just a really important takeaway is that we are making sure that insurances continue to support these life-saving services for our patients as we continue to rebuild and heal our communities.
Well, Dr. Gill, I really want to thank you for taking the time to come on the program. What you said is spot on what I think our listeners need to know. So thank you so much. This is Congressman Ralph Norman. This is a series on the health aspect of what the coronavirus is putting us through. I want to thank our radio stations who are carrying this, WRHI in Rock Hill, who produced today's program, WZZQ in Gaffney, WBCU in Union, WDXY in Sumter, and then Comporium Cable in York and Lancaster counties. We will be rebroadcasting this at my website, norman.house.gov, and my Facebook page at facebook.com/Rep Ralph Norman. You can follow me also on Facebook, Twitter, and Instagram at Rep Ralph Norman. I want to introduce now the Michael Leach. He is the State Director for the South Carolina Department of Social Services. Michael has extensive experience in child and adolescent needs, child welfare, and crisis response services. Michael, how are you?
I'm doing well. How are you, Congressman Norris?
Fine. Thank you so much for taking the time. Well, let's just get right into it for the next 15, 18 minutes that we have. South Carolina's Department of Social Services has a lot of responsibility from the prevention of abuse, helping victims. You guys deal with child support, the SNAP, the supplemental nutrition programs, adoption, foster care, and really everything in between. How has the department's role changed in light of the COVID-19 crisis?
Yeah, great question. There's no manual for how to deal with a pandemic like we are currently experiencing. In the wake of COVID-19, we've had to continue to take steps to continue our critical missions of providing food, financial assistance, and promoting the safety of children and vulnerable adults in South Carolina. We are focused on continuing operations and our essential priority business functions. We are seeing delays in some services and response times due to the ever-changing situation, especially in SNAP. One example is a supplemental nutrition assistance program. You know, in your 5th congressional counties alone, Congressman, our workload doubled in SNAP from March to February, and that puts a lot of stress on the current staff that are affected by this as well. We've also had to deal with a lot of stuff on the recent tornadoes and storm damage. We are short-staffed across all program areas, and I've seen a lot of teams step up. But we have to continue to focus on strengthening families, and but this can be difficult to maintain when we have to be concerned about keeping ourselves and our families healthy as well.
For our listeners, run down just a few of the additional roles that your agency is now taking on as a result of the COVID-19.
Yeah, so the governor's orders requiring only essential employees to report to the office has changed some ways we do business. We've had about 85% of our workforce working from home. We have about 700 individuals who continue to work at offices across the state, including the counties that are part of your district. We have had employees who have had confirmed COVID diagnoses, and we've had to put policies and practices in place to deal with that, cleaning of offices, and making sure that we're keeping our staff safe and socially distanced as much as possible, and keeping the work going. We've also had to adjust to a lot of visits with families and other constituents through the use of FaceTime or Skype to make sure that everybody is safe.
And you had brought up SNAP, and now that the pandemic has caused more and more people to be out of work, and for our listeners, the month April 25th ending then, we had 65,000 people file claims in South Carolina. What does this mean, Michael, for those that have apply online or apply for applications for the SNAP program?
Yeah, we knew when we started seeing the increase in unemployment and the stressors that are coming with this pandemic that we would probably see an increased need for SNAP. In the month of March, we issued benefits to 11,800 new cases, not existing clients, and we've issued supplements for current clients to increase. So we've increased the amount of money that we would provide families that are current SNAP recipients, and then we've also been getting a lot of new clients due to obviously current stressors during the pandemic. we've issued close to $97 million in SNAP benefits to all clients during the month of March, which is compared to an average of $67 million in paid to clients in the month of January and February. Again, more new clients and then increased amounts so that people can manage and take care of their families and provide food assistance to them. We processed 44,000 applications during the month of March, and that's about a 150% increase. Again, a lot of need, and we're trying to make sure that we get these done as quickly as possible.
Let's address something that nobody likes to talk about, but it's child abuse. And I know that you're having fewer reports of child abuse, but really that's not the whole story. It seemed like it'd be a good thing, less people report it, but walk me through what's really going on now that more people are staying in.
Yeah, so our abuse and neglect and vulnerable adult abuse intake call centers are operating normally. But as of the last week of April, we saw a 46% decrease in our reports received for child abuse and 14% decrease in our vulnerable adult abuse that's received. This is compared to about a year ago at this time. We know that parental stress and financial instability and isolation and lack of resources are factors for child abuse and neglect. And those risk factors are heightened during this current pandemic. So we also know that a decrease in referrals at this time does not mean there was a decrease in abuse and neglect, but rather a side effect of having fewer external eyes on children during this time. So teachers, kids being in school at this time or being in childcare settings, those committed, caring, loving adults who are taking care of those folks every day aren't seeing them every day, and that's some reason for some of the decrease. We're trying to make sure that we message this through social media accounts and through our partners, Department of Education and Department of Mental Health, and to advise the community that if you witness or suspect abuse or neglect or the safety or well-being of children or vulnerable adults, that you call our hotline at 1-888-227-3487.
Great. What and how's the state doing, and what's DSS doing specifically to combat this abuse of children and vulnerable adults, many who have infirmities that can't protect themselves?
Yeah, again, we've had to change a lot of things. Abuse is still occurring, although it may not be currently reported through traditional routes. Again, we believe that the less eyes with our educational professionals, guidance counselors, mandated reporters, affect this. We do see drops in reporting or calls during the summer months. Nationwide, that's a normal trend that you always see. But that's normal. We expect that. Families are expecting that, and there's still routines that go on. This has been a shift in everybody's routine, and they've had to adjust, and the stressors are more high. We have parents who are teaching, these days. But we continue to still do investigations. So if a call comes in and it is screened into our hotline, our staff are still going out and doing investigations face-to-face to make sure that children and families are safe, and adults.
And Michael, if somebody's listening to the program this morning and suspect that the abuse of a child or a vulnerable adult's taking place, how should they go about it? Should they start with the local law enforcement? What would you recommend as a 1, 2, 3 stair step to report this?
Yeah, I do think if they feel like there is an urgent safety need for a child or an adult, call 911 for sure. If there is a suspicion of abuse and neglect, they can call our hotline number at 888-227-3427, and our staff, our Adult Protective Services staff or our Child Protective Services staff will go out and investigate and coordinate with law enforcement when appropriate. Law enforcement and our CPS folks and APS folks work closely together, going out on investigations and working together to make sure that we're all on the same page.
I tell you, law enforcement, there's not a more caring group of people than law enforcement, particularly when it comes to abuse of any kind. And we'll put all this information up on my website, norman.house.gov, and so that people know exactly where to go. Now, on positive news, child support payments are an area of focus for the DSS. In March, the CARES Act provided for economic stimulus payments for most Americans. And the federal government had some rules about garnishing those payments from folks who have past due child support. Talk about the details of that, if you could, for a moment.
Yeah, so I think many of us are aware of Congress passed and President Trump signed the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act. It in part provides individuals with rebates of up to $1,200 or $2,400 if married and filing jointly, plus up to $500 for each qualifying child. The IRS and the Bureau of Fiscal Service of the Department of Treasury are preparing to process, these rebates in the form of economic impact payments in the coming days. Many of us already have them, and some people are still getting those. We still at DSS have to consider child support in those stimulus checks and what that looks like. So the federal government gave guidance that there is no exemption for child support debt. So as a result, the impact payments that someone may get or made eligible to non-custodial parents who owe past due child support and who are subject to intercept under the income tax refund offset program will be offset by the amount of past due child support. So what that's saying is that a custodial parent still potentially will get access to those payments if there are past due child support. It's a balance with child support because we want to make sure that families are getting the child support they deserve to take care of their family and the child. But we also, in this time of COVID, want to make sure that our non-custodial caregivers and parents aren't going through more barriers and difficulty as they're also trying to survive as well.
Well, one thing the CARES Act did was to provide grant opportunities for child care providers. Tell our listeners what some of these grants are for, who's eligible to apply, and how this really helps the child care providers and those that rely on these services.
Oh, sure. Yeah. So there are 2,419 regulated child care facilities in South Carolina. This includes centers, churches, and family homes. Our site, we have a site, scchildcare.org, is a great resource for both child care providers and parents. We did get funding through the CARES Act for child care in the state of South Carolina, as did every state in the nation. As part of the funding, and we just received it recently, we are offering child care assistance for parents that work in businesses that have been deemed essential during the COVID-19 pandemic. Folks that are having to respond to COVID, making sure that we assist them with child care and paying for some of that. So in order to qualify, you have to be currently working in an essential business. You must need child care, so you have to continue to work and continue to and complete a child care application. You do not have to meet any income guidelines, and more information is on our DSS website and the scchildcare.org website. We've received close to 3,000 requests. We are working as quickly as possible through these requests and have approved approximately about $3.6 million in vouchers for about 900 children across the state.
Let me add for our listeners, don't give up. If you think you may be eligible or want to think about applying and don't have a way or don't feel like you can actually do that, call on our office. norman.house.gov, or call us. We will walk you through the process. This is a great program to to be aware of. Challenges that I guess are unique now, Michael, that you can just touch on?
Yeah. A couple other things real quick is that we also are applying child care grants for cleaning and sanitation for child care centers. And coming soon, we're also working on other grants to child care providers to ensure they're able to remain open or reopen quickly and safely. We obviously have to put a process in place, and we want to do it as quickly as possible to make sure we can get this money out to the child care centers so that will help them. Challenges facing, DSS and child care facilities and everything else is that, we continue to try to communicate with all our constituencies, our group homes, our child care providers, foster homes, families that we work with. We serve 1 in 6 citizens in South Carolina. And so trying to make sure that we continue communication, we update them with the best, most recent information to help them make decisions in regards to whether they continue to operate, how they support children and families. So that's been a challenge, making sure that we keep, because the information is coming so quick, and things are changing on a daily that it is hard to keep people updated. And this includes our own staff, making sure that they understand what's going on with this. And the biggest thing is making sure people have the facts so that we can, make sure that we ease anxiety and fears about all of this, and make sure people are safe, but also keep things moving to strengthen families.
Well, we appreciate what you're doing. The whole response that we've seen has been phenomenal. But the best description I heard was it's like building an airplane while you're taking off. And that's what many of the agencies have felt, and that's what I know those of us in the political arena have seen. Touch just briefly on the preschool development block grant. What's happening on this front?
Yeah, so DSS has been able to engage our federal partners at the Health and Human Services at the federal level and the Administration of Children and Families in the Office of Child Care, and we have some good news. We got an $11 million a year preschool development grant that has been renewed. We've had it, but it was renewed, and we continue to work with early childhood partners to serve our state's youngest citizens. So the grant is birthed through 5, and it's made possible through funds through Congress added to the 2020 spending bill. The initial funds, PDG funds, were used to develop a statewide early childhood needs assessment, strategic plan, and a web portal to help parents of young children access early learning programs. And so we will continue to figure out what we need now for our partners and our families to make sure that we're connecting to quality child care. And I want to thank our DSS Child Care Division for advocating for South Carolina's children and families and remaining diligent in this difficult time to get this money. So this is great for the state of South Carolina, and thank you, Congressman Norman, and your colleagues for supporting the preschool development funding.
Well, it's an honor to do, and I just want to thank you for your service as director of DSS. How's your staff doing physically and emotionally?
Thank you for asking that question. I want to thank our 4,300 DSS professionals for their continued dedication, passion, enthusiasm for what they do. We have professionals across the state who are working nonstop to help get food benefits to feed families because we know more people are in need. We've seen increased call volumes, putting more pressure on our team members. We have staff working to make sure families continue to receive the needed child support payments. We have staff working to set up temporary child care centers and others who are providing needed support to those child care centers who are still remaining open. We have professionals who are putting themselves in harm's way in order to fill responsibilities for investigations around abuse and neglect. Our staff are worried about their health and their families while trying to make sure others are safe and fed. And our staff are acting in roles very similar to first responders at times. People don't think of that our staff in that way. But social workers and people who work in our field are givers. They go to work and deal with extremely difficult situations, and frequently have to sacrifice time with their families and friends to care for others, but aren't often given prestige for this important work. They're anxious and afraid like everybody else, and they're continuing to get this job done so that the citizens of South Carolina have what they need.
Well, Michael Leach, I just want to thank you. You're head of DSS for our listeners who tuned in late. Thank you for your service, and we really appreciate you taking the time to come on the air and inform our listeners about what's going on with the Department of Health of Social Services. Thank you so much. Okay, this is Congressman Ralph Norman. We have fifth of a series of informing the public on the CARES Act, the first four of our programs now. We're focusing on more of the physical and mental health. We've got two great experts with us today. Got Dr. Craig Charles, is the medical director for Affinity, and Anita Case, who is the center's executive director and known for a long time, does a fantastic job. Thank both of you for joining us. The CDC recently updated their guidance on symptoms suggestive of COVID-19. Can you update us on the symptoms of COVID to watch for, and when should our listeners call our healthcare provider if you're just not feeling well? Doctor?
Thank you, Congressman. So I think we all recall when COVID first came around, we were told the standard symptoms to expect: the cough, the shortness of breath, the fever, and every week new symptoms seem to be attached to this syndrome, which has made it all that much more difficult to handle, to screen people for potential testing and such. And so the next things that came out were a little unusual. I remember seeing a patient who said, "I lost my sense of taste and smell this morning." And that was our first positive test, was a patient who responded to different questions with kind of an unusual answer. And sure enough, a few days later, the CDC reported that this was being reported by patients around the country. And so each week there's been newer symptom complexes added to help keep us on our toes so that we can screen people appropriately. The next thing we heard about was some GI symptoms, which you don't necessarily associate with a respiratory virus. We started hearing about nausea, vomiting, and diarrhea, and sure enough, we've had some patients with those symptoms test positive. And then today, I've read that there's also something called COVID toes, where the skin on the tops of the toes becomes slightly discolored, and this is a new symptom that is being reported and associated with COVID. So every week we learn about some new symptoms to hear about. If the patient doesn't say they are having fever, we need to be aware that they might be having chills, which is often a surrogate of a fever. So those are sort of our symptom complex that we keep updating on our screening questions that we ask of patients who come to the clinic. And so it's a quickly evolving problem that
Changing every day, isn't it?
Yeah, it sure is.
Anita Case, I know you've been on the front lines and see it all. You want to add to what Dr. Charles said?
Well, he is the expert. I would just add that we're also screening for sore throat. I mean, I think that was one of the newer ones, and I think he covered it beyond that. So we've definitely had folks who test positive who did not have a fever. So I think just being aware of all the different symptoms is important.
Let me ask either one of you or both of you, if symptoms are mild and really don't appear to be worsening, is it likely that the doctors will provide testing or recommend testing, I guess?
I think it depends, and it depends on whether that doctor has the ability to test that patient or to send them where they can be tested. Mm-hmm. Because if a provider is contacted by a patient with some symptoms and they're not really sure how to test, maybe their clinic, their office doesn't have the ability to test, they may be reluctant to recommend testing for that patient. For us, it's easier because we are doing aggressive testing. And anybody who calls in with any of those single symptom complex items that we just outlined, any one symptom, we're recommending they be tested.
Let me ask this. If our listeners don't have a health care provider, they do not have a doctor, what do they do?
Well, I will say that across your district, there are community health centers. And so I think it's a great time to engage and get a primary care provider if you don't have one. And all of the health centers across our state are doing telehealth. So it's a great time to connect. You can get started with health care through telehealth safely from your home. You can get assessed for COVID, through telehealth. So I think it's an opportunity to reach out and find out who are your health centers in your community health centers. Also, I think private practices are accepting new patients. Everyone needs a healthcare home, and this is just one opportunity to get connected.
But our testing capacity is pretty substantial, and we're testing anyone, all comers. If they're registered patients with our clinic, great. We'll certainly test you. But if you're just a community member who doesn't already have a provider, or your provider's just not offering testing, we'll screen you for the symptoms, and we will line you up to come through our parking lot to go into the testing queue, and we will collect specimens and submit them for testing and let you know what your results are.
What's the timeline now? If I come in and get a test, how long do you wait?
Well, if you're positive, we're probably going to know about that in about 24 hours, maybe even less. Negatives are taking longer. They're obviously not priority reporting. The lab is not calling me in the middle of the night to tell me that your test was negative. They are calling me to tell me that your test was positive. So sometimes we have to actually reach out to LabCorp, our lab source, and get those negative results so that we can pass them on to the patients and let them take them to their employer and be cleared to go back to work. So in essence, within 48 hours, I should know if you're a positive. It may take anywhere from 3 to 4 days to finally get our hands on the negative test results.
That's an improvement, big time.
It is.
It is.
Mm-hmm.
The CARES Act requires health insurance plans to cover COVID-19 testing, and it also provides reimbursement for providers who test uninsured patients. So if I'm uninsured and need a test but haven't yet met my deductible, I still won't have any out-of-pocket expenses. Is that right?
That's right.
Yes, I think the one thing to be mindful of is I know that the COVID testing is covered, but if you get other services during that same visit, you just want to be mindful of those costs. Like if you got a strep test as a part of that visit, then you might have that cost. But a lot of uninsured folks can get tested through community health centers like us, and it's no cost to them. And then insured folks who get testing with us or with the other health centers, that's free of charge as well.
All right. Now, for our listeners, what paperwork or documentation should they bring with them? Insurance card. If they're uninsured, what type of ID? What should they bring?
So we do ask people to bring their insurance card, but at Affinity Health Center, we're also collecting that information on the phone because we want to limit that exposure. So we're just going to be very quick with the test and any documentation that we're exchanging. We do look at IDs. If someone doesn't have an ID, we don't want that to be a barrier to testing. So, we're just looking, is this the person that we screened on the phone, and make sure that the lab is notified of the right person. So even a debit card, a credit card, anything with someone's name, we can accept that as well. So yes, insurance card if you have one, ID if you have one, or some form of proof of who you are. That's really it.
Great. Now, walk me through the test itself. And I've heard a lot of people, you've seen it on TV, they take the swab and there's a reaction that is it painful? Well, walk me through what that process is.
All right. Well, first, the patient calls and inquires about testing, and they're asked a list of questions to see if we really want to test, because we're still following the CDC recommendation to test symptomatic people and not asymptomatic people. A lot of people want just screening. Have I had it? Did I have it last month when I was sick? We don't do that yet, not at Affinity. So the patient calls, they get screened. If they have any of those symptoms we outlined, even just one, we put them in line to be tested. They come to our parking lot, they come to Affinity, and we have a parking attendant meet them and hand them a consent form, and we ask them to read and sign a consent form and show us their ID to identify it's the right patient we scheduled. Then they simply pull through the parking lot up to a tent where we have our testing crew made up of a nurse and a couple assistants. And they roll down their window, they're identified, and they are, we have a test kit with a requisition, a lab requisition. Now, here's where the swab comes in. Our folks on the test crew will collect the specimen. Now, there are two basic types of swabs that can be submitted for COVID testing. There's what's called a nasopharyngeal, and the naso means nose, and there's oropharyngeal, and the oro means mouth. Either one is accepted by LabCorp for testing, and you don't have to have both. You can have one or the other, or you can use both if you choose, but we only collect one specimen. In our parking lot drive-through testing, we stick with the oropharyngeal swab. The swab is probably about 8 inches long or so. It looks like a very long Q-tip, and it's just like a strep test, if anyone's ever had a strep test. They have the patient open their mouth, they do a quick swab along the tonsils. They really need to get good contact with the tonsils, so it can be a little uncomfortable. And some people who have a very sensitive gag reflex may also have a little discomfort from that. But they get a good swab of the tonsils, and that's it.
How about the nasal?
Now, the nasal swab, which we do more often in the clinic. Now, if someone gets into the clinic and we realize, oh, this is a COVID patient, I might do a nasopharyngeal swab. And that's, if you've ever been to the carnival and saw that guy who pretended to drive a nail into his nose, well, the reason that works is because the passageway right along the base of the hard palate is a clear pathway to the back of the throat. So that is a very long swab. It is very thin, but it's very long, and it just goes right along the floor of the palate in the nasal passageways all the way to the back of the throat. Yes, it can be very uncomfortable, and people usually react appropriately. But that's if you do it right, because if you do it wrong, you won't get a good specimen, and you may get a false negative test. So if you have someone take that swab and they just kind of rub up and around the front of the nose, that little space up in the front of the nose, that's not the way to do it. You have to get way back there. And it's a harder test to collect, and that's why we stick with the oropharyngeal swab in the drive-through, and we only do the nasopharyngeal for some folks who come into the clinic itself.
Okay, say I've gotten the test, you have not gotten the results back. What should you do if you've been affected, and is it you got a test for a reason? Should they self-quarantine? Should they? What advice would y'all give?
Yes, you're right. And I want to take a second to explain the two terms that are often used interchangeably and explain the difference. There's quarantine and there's isolation. We've all heard both of those words. Quarantine is what we typically do for well people. Like, I got exposed to somebody with COVID and I'm worried about getting sick and I want to stay away from folks. I'm going to quarantine myself at home in case I become symptomatic. Isolate is what we do for folks who are sick. Isolate yourself at home, still the same kind of thing, but it's the terminology is different. If you're sick, we want you to isolate until you get better so that you don't pass it on to other people. So someone who's coming through our drive-through, they have symptoms because we only test symptomatic people. They're symptomatic for something, so it might be COVID. So yes, we want them to isolate at home until we know whether or not it was COVID positive or COVID negative.
And who will actually call?
We have a nurse also. Well, for positives, we have a nurse who will make the call and instruct them of the results, and also give them some instructions and advice on what to do. Positives should also expect to be called by our state DHEC office because they will be checking on the epidemiology aspect of it, contacts, and things like that. Negatives are going to be called either by our nurse or some other support staff at the clinic who are able to just call and give a negative report and tell them that it was negative, they're okay.
What is the ratio of? I mean, if you test negative, is that a pretty high? Is your success fail rate?
Yeah, that's a good question, and it's hard to answer with a whole lot of certainty. I will say this: if your test is positive, you can take that one to the bank. The what's called the specificity of this test is really, really high. That means if it's a positive, it's very likely to be a true positive and not a false positive. The negatives are a different story, and they're a little more difficult to answer because there's so many factors that apply to this. Collecting the specimen itself. If the person collecting the specimen didn't do a very good job, you may get a false negative. Time of day can even play a role, because of when you get back to the back of the throat where the virus we expect it to be, it might not be very plentiful at that point of day or in that spot of the throat, so you may get a poor specimen. So what's called sensitivity is more difficult to answer. How likely are the negatives to be true negatives? There are some reports that we might even have 30% false negatives. So it's a little worrisome, but the best thing to do is try to get a good specimen, try to do it right, try to collect it correctly.
And I'll remind the listeners, it starts with, if you suspect you may have it, it starts with going to to get tested, and that's the beginning point. So what's on the horizon for testing? I mean, you hear about changes with the heat, with the summer. Is that what's your take on that?
Well, the thing about the seasons and the warm weather that I'm hopeful for is that it helps people stay away from each other more. This distancing, the reason we have cold and flu season in the cold weather months of the year is because that's when people are gathered together, schools are in session, kids are all together, people gather indoors to get out of the cold. And that's why we trade colds and flu in the cold weather months. And in the warm weather months in the United States, we get away from each other more, and it breaks the cycle. So I'm hopeful that will play a role in our flattening the curve as well. But in addition to that, we also are going to want to know who has had it, who had it and got over it, who had it and didn't even know it. And that's where some of these antibody testing techniques are going to come into play, because that's the way we tell who actually had it and who didn't. Those are on the horizon. There are some available right now. We are not doing that kind of testing at Affinity, but it's going to be a very important component going forward of figuring out what was the incidence, how many people really did have it, and then calculating how many people died, who had it, because the death rate may be lower once we realize the number of people who had it and didn't even know it. So that's going to be something that will be pushed to do later, probably in the warm weather months as well. Not necessarily seasonal, but just as the availability of that testing comes out.
Well, y'all have done a great job. How is your staff holding up, Anita?
I think much like Michael from DSS, I mean, our staff are, they're dealing with the same concerns, fears, anxiety that everyone else is. They all come to work every day, and they know that they need to be there because we're healthcare providers, but they still go home to their children or the people they're caring for. They are concerned and fearful, but I think they are strong. They're doing the best they can. We've tried to get creative in how we offer support and provide opportunities for folks to just lean on each other a little more, and recognizing you may need to take a walk a few times a day, or just get away and to take a breather. We've done some meditation, mindfulness things. So I think that much like the rest of the country, that they're scared and they're afraid, but they're committed. And I think that's healthcare workers all over, and social workers and all of those in the helping field who are continuing to go to work every day and serve people and put themselves at risk, but also knowing that this is what they've been called to do, and what they need to do.
Well, your family really are.
Yes.
Okay, Anita Case, Dr. Craig Charles with Affinity Healthcare. Great center. I've been through there, Anita, when you call me. Great people there. It's a calling. So thank you for what you're doing. We appreciate you taking the time to come. Let me, this is Congressman Ralph Norman. All of this will be rebroadcast on my Facebook and on norman.house.gov with numbers. Affinity is located on Anderson Road beside the BTC Center, Business Technology Center. I want to thank the radio stations and for carrying today's broadcast, WRHI in Rock Hill, who produced today's program, WZZQ in Gaffney, WBCU in Union, WDXY in Sumter, and Comporium Cable in York and Lancaster counties. You can follow me on Facebook, on Twitter, Instagram, Rep. Ralph Norman, and again on my website, norman.house.gov. This is a trying time, folks, and this time when all of us, there's no wrong answer. It's just mainly doing things that are proactive. We come together at a time like this, and I think now more than ever that it's it's time to become family as a nation and get this behind us, which we will do. And it's not going to be easy. It's something that hit us out of left field. But I just thank all those on the front lines, like Dr. Yu and Anita are on, to make this happen and to make us more successful. We're going to come out of this stronger than we have. A lot of great things, the telemedicine that's happening now. And I think it's just the beginning it's the new normal for America. And it's one that we've got to come out better, which we will. Thank each one of you. Thank all of our listeners. God bless each and every one of you.
South Carolina's most honored radio station. News Talk 100.1 WRHI Rock Hill. W261CY Rock Hill. The voice of York County.
An OTS media station.
Fox News. I'm Chris.